Let's practice NCLEX questions.
The nurse teaches a multigravid client at 36 weeks gestation diagnosed with severe hydramnios about the possible complications of this condition. Which client's statement S indicate the need for further instruction? Select all that apply. A. Because I have hydramnios, I may gain weight. B. Hydramnios has been associated with gastrointestinal disorders in the fetus. C. I should continue to eat high-fiber foods and avoid constipation. D. I can continue to work at my job at the automobile factory until labor starts. E. I will need frequent stress tests until birth. Answer: D and E. Rationale: the client needs further instructions when they say, I can continue to work at my job at the automobile factory until labor starts and I will need weekly frequent stress tests until birth. The goal is to avoid preterm labor. Because the client is experiencing severe hydramnios, the client will most likely be maintained on bed rest to increase uteroplacental circulation and reduce pressure on the cervix. Stress tests, which assess the fetus's responses to contractions, carry the risk for causing preterm labor, especially in clients with known risks. If a stress test is indicated, it is usually done very near term and is seldom repeated. The nurse should expect that the client may need frequent non-stress tests to monitor fetal well-being. Hydramnios has been associated with increased weight gain caused by increased amniotic fluid volume. Hydramnios has been associated with gastrointestinal disorders in the fetus, such as tracheoesophageal fistula with stenosis or intestinal obstruction. The client should continue to eat high-fiber foods and should avoid straining, which could lead to ruptured membranes. Stool softeners may also be prescribed. The client should report any symptoms of fluid rupture or labor. The nurse is instructing a client on how to care for skin that has become dry after radiation therapy. Which statement by the client indicates that they understand the teaching? A. I should take antihistamines to decrease the itching I'm experiencing. B. It's safe to apply a non-perfumed lotion to my skin. C. A heating pad set on the lowest setting will help decrease my discomfort. D. I can apply an over-the-counter medicated ointment to relieve the dryness. Answer: B. Rationale: irradiated skin can become dry and irritated, resulting in itching and discomfort. The client should be instructed to clean the skin gently and apply non-perfumed, non-irritating lotions to help relieve dryness. Taking an antihistamine does not relieve the skin dryness that is causing the itching. Heat should not be applied to the area because it can cause further irritation. Medicated ointments should not be applied to the skin without the prescription of the radiation therapist. A nurse is preparing to administer intravenous medication to a client. In addition to the client's name, which additional identifier does the nurse check? A. Allergies. B. Healthcare provider's name. C. Birth date. D. Room number. Answer: C. Rationale: the nurse is required to check the name and a second identifier. This varies by institution but typically includes the client's birth date or account number. The healthcare provider's name and room number may change during a healthcare encounter. Although the nurse should note if the client is allergic to the medication, verifying allergies is not a client identifier. The nurse has just removed a client's nasogastric NG tube. What should the nurse do next? A. Provide the client with oral hygiene. B. Offer the client liquids to drink. C. Encourage the client to cough and deep breathe. D. Auscultate the client's bowel sounds. Answer: A. Rationale: The nurse's first action after the removal of an NG tube is to provide the client with oral hygiene. Then it is appropriate to give the client liquids to drink if the client is no longer on nothing bimouth status. There is no association between the removal of an NG tube and having the client cough and deep breathe. Auscultating the client's bowel sounds should be done before the removal of the NG tube. The nurse is making a home visit to an older adult who is living with their child. The client has scald burns on the hands, both forearms, and the neck, 10 first and second degree burns. What should the nurse do? Select all that apply. A. Rinse the wounds with cool water. B. Apply antibiotic cream. C. Remove clothing near the area. D. Call for transport to a hospital. E. Cover the burns with a sterile dressing. F. Investigate the possibility of older adult abuse. Answer: A, C, D, and F. Rationale: the nurse can administer first aid by rinsing the area with cool water and removing clothing in the area. Because the burns are near the neck, the nurse should then call for transport to a hospital. The client's age and the extent of the burns require care by a healthcare team. Additionally, the nurse should consider that the client may be experiencing older adult abuse and investigate further as needed. The nurse should refrain from applying antibiotic cream or covering the area with a sterile dressing.
Thank you. Visit my channel for more NCLEX practice questions.